My name is Dr Pasupathy. I'm a senior clinical research fellow with the Queen Elizabeth Hospital and the University of Adelaide. I work with heart attack patients. Most heart attack happens because of cholesterol artery blockages. But when 1 in 10 heart attacks happen without the blockages, known as MINOCA or myocardial infarction with non-obstructive coronary arteries. This uncommon group of heart attack patients are my key interest in research. When we do know the heart attack happens because of the coronary artery blockages, we do know how to treat them or how to treat them with the interventions and medical treatment. But when we come across heart attack patients that do not have the blockages, we don't have a clear understanding about how to provide the appropriate treatment for them. The research at the Queen Elizabeth Hospital actually focuses in this group of patients as a whole package. We have registry data to study these patients' characteristics, and also we have been performing studies to understand their causes for their presentations, and also we have been working on clinical trials that can look at the treatment strategies for these patients. The primary outcome of our research here at the Queen Elizabeth Hospital is that we have been able to treat these patients in hospital with a better understanding about why they are coming in, and to provide the right tools or the right diagnostic testing that we can perform while they're in hospital or just after they get discharged, so their treatment can be optimized. Rushing to hospital in an ambulance with all the telltale signs of heart attack, being told by the treating team, the paramedics, you are having a heart attack, and have this coronary angiogram procedure and saying that this gonna be you're gonna be needing treatment like stents or angioplasty or bypass surgery, and then you find out no, it wasn't a heart attack. And then they don't have the right reason why this all happened to me. It causes a lot of anxiety in patients and a lot of concern. Is it going to happen to me again? How would I recognize a real heart attack from this false heart attack? So this causes a lot of stress to the patients. So in a care system, for the longest time, we didn't have how to tell what happened to these patients. The nurses, the doctors usually don't have a clear guidelines to how to care for these patients. So more often than not, they do get discharged from the hospital care. Our research contributed to the international scientific guidelines about how to care for these patients, what are the right things to tell them or how to treat them, and how to care for these patients. So that is the most significant outcome from our research.